Fresh produce HACCP and PCHF principles. What is HACCP? Hazard Analysis of Critical Control Point, HACCP. A food safety system that identifies critical control points, CCPs, in food production where food safety risks are thought possible. HACCP team. The HACCP team is comprised of a total of 8 individuals. The company's 2 safety managers have been appointed as the HACCP coordinators for the 2 facilities. See next slide for complete team list. The HACCP team is responsible for the development, implementation, and maintenance of the HACCP system. The HACCP team will meet quarterly to discuss the status of the HACCP program and address any concerns or issues. The HACCP risk assessment analysis will be reviewed and updated on an annual basis or if there is a change in the process flow of the facility. HACCP team members. Please see the list below for the HACCP teams at Price Freshpack and Harry H. Price & Son. Please note that personnel can change over time and each list will be updated as needed. HACCP Principles. Basic Principles of HACCP. Conduct a hazard analysis. Identify critical control points. Establish critical limits for each critical control point. Establish critical control point monitoring requirements. Establish corrective actions. Establish record-keeping procedures. Establish procedures for verifying the HACCP system is working as intended. 1. Conduct a hazard analysis. The purpose of a hazard analysis is to develop a list of hazards which are likely to cause injury or illness if they are not controlled. Points to be considered in this analysis can include skill level of employees, transport of food, serving elderly, sick, very young children, immune-compromised, volume cooling, thawing of potentially hazardous foods, high degree of food handling and contact, adequacy of preparation and holding equipment available, storage, and method of preparation. The next step is to determine if the factors may influence the likelihood and severity of occurrence of the hazard. Finally, the hazards associated with each step in the flow of food should be listed along with the measures necessary to eliminate, control or mitigate the hazard. 2. Identify critical control points. A critical control point is any step in which hazards can be prevented, eliminated or reduced to acceptable levels. CCPs are usually practices/procedures which, when not done correctly, are the leading causes of foodborne illness outbreaks. Examples of critical control points include cooking, cooling, reheating, holding. To determine CCPs, ask the following questions. At this step in preparation, can food become contaminated and/or can contamination increase? Can this hazard be prevented through corrective actions? Can this hazard be prevented, eliminated, or reduced by steps taken later in the preparation process? Can you monitor the CCP? How will you measure the CCP? Can you document the CCP? Identify critical areas. This is the process flowchart map for Price Freshpack. Identify critical areas. This is the process flowchart map for Harry H. Price & Son. Three. Establish critical limits of CCPs. A critical limit ensures that a biological, chemical or physical hazard is controlled by a CCP. Each CCP should have at least one critical limit. Critical limits must be something that can be monitored by measurement or observation. They must be scientifically and/or regulatory based. Examples include temperature, time, pH, water activity, or available chlorine. 4. Establish critical limits monitoring requirements. A critical limit is a measurable threshold that must not be exceeded. Critical limits ensure that a biological, chemical, or physical hazard is controlled at a critical control point. Each CCP should have at least one critical limit. 5. Establish corrective actions. Corrective actions are actions to be taken when monitoring indicates a deviation from an established critical limit. The final rule requires a plant's PCHFS/HACCP plan to identify the corrective actions to be taken if a critical limit is not met. Corrective actions are intended to ensure that no product dangerous to health, or otherwise adulterated as a result of the deviation, enters general commerce. PCHFS/HACCP plans should include the following. Who is responsible for implementing the corrective action and what corrective action was taken? Corrective actions should be established in advance as part of the PCHFS/HACCP plans. 6. Establish record-keeping procedures. The PCHFS/HACCP regulation requires that all processors maintain certain documents, including its hazard analysis and written PCHFS/HACCP plan, and records documenting the monitoring of critical control points, critical limits, verification activities, and the handling of processing deviations. Record-keeping and documentation procedures should be simple to complete and include information that illustrates that the established standards are being met. Employees need to be trained on the record-keeping procedures and why it is a critical part of their job. Examples of records include time/temperature logs, checklists, forms, flowcharts, employee training records, and SOPs. 7. Establish procedures for verification. Validation ensures that the plans do what they were designed to do, that is, they are successful in ensuring the production of safe product. Plants will be required to validate their own PCHFS/HACCP plans. Verification ensures the PCHFS/HACCP plans are adequate, that is, working as intended. Verification procedures may include such activities as review of PCHFS/HACCP plans, CCP records, critical limits, and microbial sampling and analysis. Annual review requirements. PCHFS/HACCP plan review. Hazard analysis. Should be reviewed annually to determine if changes have occurred that would affect the product description and/or process flow. Process flow charts. Should be reviewed annually to determine if changes have been made. PCHFS/HACCP team. Should be reviewed annually to update changes in staffing and training requirements. Product description. Should be reviewed annually and updated to reflect any changes in the description of the finished product, raw materials, processing/handling procedures, processing aids, packaging, storage, distribution, intended use, and/or target industries and consumers. Questions, comments, or concerns?